Were you aware that certain fruits, yes, fruits, may worsen blood sugar spikes more than a can of soda, accelerate aging, and harm the brain? A 2023 study published in the Journal of Clinical Nutrition found that regular consumption of certain high-sugar fruits increased the risk of metabolic syndrome, a serious illness associated with heart failure, diabetes, and stroke, by 57% in individuals over 65. The most terrifying aspect? These are the same fruits that are promoted as being nutritious or aiding in digestion, but they may be subtly harming your body on a daily basis. Additionally, if you are over 65, the wrong fruit can cause serious injury quickly since your metabolism slows down, your cells become more sensitive, and your tolerance for sugar drastically decreases. However, there is also good news. For elderly people, some fruits are like natural medicine. They strengthen your heart, lower blood pressure, and even make your brain appear younger than it actually is. The 4 fruits that seniors should consume daily and the 4 that they should absolutely avoid are shown in this video. Don't overlook the last one on the list of dangers. Millions of people adore it because it's juicy and sweet and may be subtly depleting your energy and shortening your life. Please provide your viewing location in the comments section below before we start. And remember to like and subscribe to our channel for more videos like this one. Now let's get started without further ado. Avocados come in at number 4. Indeed, avocados are considered fruits, and for good reason they merit a unique place here. Avocados are among the healthiest foods seniors can include in their diets, despite the obsolete nutritional guidelines that advised against all dietary fats. Avocados are special because of their high monounsaturated fat content, especially oleic acid, which has been demonstrated to dramatically lower harmful LDL cholesterol levels while raising beneficial HDL levels. Because of this particular fat composition, avocados are incredibly beneficial for seniors managing cardiovascular issues, because lower cholesterol levels are directly linked to a lower risk of heart attack and stroke. However, that is only the start. Since hypertension affects over 2/3 of persons over 65, many seniors are unaware that avocados are an excellent way to regulate blood pressure since they contain more potassium than bananas, roughly 975 milligrams per fruit. Without the need for further medicine, the potassium in avocados naturally lowers blood pressure readings by relaxing blood vessel walls and regulating sodium consumption. In addition to its cardiovascular advantages, avocados are a good source of lutein, an antioxidant carotenoid that has been demonstrated to enhance eye health and slow the advancement of age-related macular degeneration, one of the main causes of vision loss in the elderly. However, avocados' ability to promote nutrient absorption is arguably their most underappreciated advantage. Vegetables contain a lot of fat-soluble vitamins and antioxidants, such as D, E, and K, which your body needs fat to absorb. The absorption of these essential elements can be increased by up to 15 times when avocado is eaten with cooked greens or a salad. For anyone looking to maximize their food intake without taking a ton of supplements, it is a tremendous boost. How do you obtain all of these advantages then? To enjoy the benefits, you only need to eat half an avocado each day. You may eat it with a spoon and a squeeze of lemon, spread it on whole grain bread, or blend it into a smoothie. This fruit is a true game changer for elder health, regardless of how you choose to consume it. Third place, apples. Apples are a great source of fiber, especially pectin, which is helpful for your gut's beneficial bacteria. 3 factors that grow more crucial as we age are better digestion, increased immunity, and enhanced nutrient absorption, all of which are facilitated by a healthier gut. Apples' impact on heart health, however, is much more remarkable. Over time, pectin effectively lowers your LDL cholesterol levels by binding to cholesterol in the digestive tract and assisting in its removal from the body. Flavonoids like quercetin, which lower inflammation and promote cardiovascular health, are also found in apples, not to mention their function in controlling blood sugar. Apples have a comparatively low glycemic load despite their sweetness, and their fiber reduces blood sugar absorption, avoiding spikes and crashes. This can be quite beneficial for older adults with type 2 diabetes or insulin resistance. Because of their high fiber and water content, apples are also very filling and can help regulate hunger. Here's something that not many people are aware of. Apple chewing increases saliva production, which lowers the risk of gum disease and cavities, two conditions that worsen with age. Apples, whether red, green, or yellow, are among the most widely available and adaptable fruits. Including one apple in your daily diet can help support almost all of your body's key systems. Second place, a pomegranate. When considering everyday snacks, pomegranates might not be the first fruit that springs to mind. But for seniors, this ruby red fruit is like liquid gold for the heart. Our arteries naturally start to stiffen as we age, which can cause blood flow to decrease, blood pressure to rise, and the heart to work harder. Pomegranates are unique because of their abundance of punicallogens, a potent antioxidant that has been shown in research published in the journal Atherosclerosis to lower oxidative stress in the arteries by more than 30%. Punicallogens may actually have up to 3 times the antioxidant activity of green tea or red wine, according to studies. Similar to rust in an old water pipe, oxidative stress causes the walls of your arteries to thin and become inflamed. However, punicallogens aid in removing that, facilitating easier and more fluid blood flow. Additionally, pomegranate juice has been demonstrated to reduce systolic blood pressure in hypertensive individuals by 5 to 21%, which is significant for elderly individuals attempting to control their blood pressure without taking more medication. That's not all, though. Additionally, pomegranates help with brain and memory function. According to UCLA research, older persons who regularly drank pomegranate juice outperformed those who didn't on verbal memory tests. This is important since one of the most dreaded consequences of aging is memory loss. Pomegranate juice, which doesn't require chewing, has many of the same advantages for people who are worried about dental problems. Although eating entire fruits offers more fiber and minerals, even concentrated antioxidant supplements have demonstrated encouraging outcomes. Here's the problem, though. It's not necessary to consume one entire glass each day. There are significant health benefits even if you only eat half a cup of the seeds or add a little juice to your morning smoothie. Additionally, pomegranates don't produce sudden rises in blood sugar because they have a low glycemic index, in contrast to many other sugary fruits. For elderly people with type 2 diabetes or pre-diabetes, that is ideal. Just be sure to get pomegranate juice that is 100% pure and devoid of added sugar. Additionally, because pomegranates can mildly conflict with some drugs, it is always advisable to speak with your doctor first if you are taking blood thinners. Overall, though, this fruit is more than just healthful. By keeping your heart younger for longer, it may really help you live a longer life. First place, blackberries, raspberries, blueberries, and berries. Berries, particularly blueberries, raspberries, and blackberries, rank highest on our list of fruits that are good for seniors because they provide the most remarkable combination of age-defined qualities of any food. Berries' particular effects on brain health and cognitive performance make them especially advantageous for elders. Anthocyanins, which are naturally occurring plant components that give blueberries their vivid color and serve as potent antioxidants, are abundant in these tiny jewels. These substances act by lowering inflammation and enhancing cell-to-cell communication in the brain when you eat berries. According to a recently published study in the journal Annals of Neurology, seniors who ate only 2 servings of blueberries a week experienced demonstrable delays in cognitive aging of up to 2.5 years. In other words, they virtually retained the mental capacity of a person who was 2.5 years younger. Berries' special capacity to penetrate the blood-brain barrier and immediately counteract oxidative damage in brain tissues seems to be responsible for this protective impact on the brain. Furthermore, the advantages extend beyond memory. Additionally, blueberries enhance coordination and balance, which is important for reducing falls, which are a major source of injuries among the elderly. Regular berry consumption has equally dramatic cardiovascular advantages. Several studies have found that older persons who include berries in their daily diets experience large drops in blood pressure, improvements in arterial flexibility, and a decrease in inflammation markers. Since heart disease is still the largest cause of mortality for seniors, these effects translate into quantifiable decreases in the risk of heart disease. In addition to these significant advantages, berries have remarkable blood sugar regulating qualities. Their fiber and bioactive components help to stabilize blood sugar levels after meals, avoiding the risky blood sugar spikes that can worsen diabetes or pre-diabetic disorders that are frequent in older persons. Berries' 8 grams of fiber per cup helps maintain digestive health and encourage regular bowel movements without upsetting delicate digestive systems. Whether added to oatmeal, yogurt, or a smoothie, just 1 cup per day can have a significant impact on mood, energy, and focus. Just be sure to use either frozen or fresh blueberries. Avoid the dried ones, as they are frequently high in added sugars, negating their health benefits. After discovering the top 4 fruits that seniors should never eat, let's explore the 4 that they should never touch, beginning with one that may already be lurking in your kitchen. The 4th item is grapes. Grapes appear to be an innocuous, even healthful snack at first appearance. They are tiny, sweet, and refreshing, and the red or black ones in particular are said to be a good source of antioxidants. However, grapes can be misleading to elderly people. Their extremely low fiber load and high sugar content are among the main causes for worry. Because grapes are so easy to eat by the handful, it's quite easy to ingest considerably more sugar than you think. Glucose fructose is the sort of sugar found in grapes. Indeed, 23 grams of sugar, roughly the equivalent of a tiny candy bar, can be found in just 1 cup of grapes. This can be disastrous for older folks who may already be struggling with blood sugar control. Because there is less fiber, the sugar is quickly absorbed into the system, which causes insulin and blood glucose levels to rise. Furthermore, these variations are not merely transitory. They are associated with an elevated risk of type 2 diabetes, weight gain, and inflammation. Additionally, if grapes are not purchased organic, they are frequently covered in pesticide residues. And elderly people who have compromised immune systems or delicate digestive systems may be particularly susceptible to these toxins. Even the grape's thin, easily chewed skin has little nutritional value when compared to the skins of other fruits, such as apples or pears. The bottom line, then? Despite their seemingly harmless appearance, grapes are actually a blood sugar disaster, which is particularly harmful for elderly people who are attempting to maintain stable energy levels, weight, and metabolic health. 3rd place. Dried fruits. Despite their seeming ease and wholesomeness, dried fruits, especially those that are professionally treated with sulfites, represent one of the fruit options that can cause problems for seniors. The sugar content of dried fruits is extremely concentrated, which is the most pressing issue. Fruit sugar in a highly concentrated state is basically what's left over after the water is eliminated during the drying process. It is very simple to ingest excessive amounts of fructose without the fiber and water content that would typically produce satiety signals. For instance, a tiny handful of dried apricots has about the same amount of sugar as consuming several whole fresh apricots. Even in small doses, this sugar concentration can produce substantial blood glucose rises, making it especially harmful for seniors with diabetes or insulin resistance. This can eventually result in type 2 diabetes, or make diabetes that already exists far more difficult to control, but the harm doesn't end there. Additionally, these sugar spikes cause the body to become more inflamed, which can exacerbate arthritis pain, hasten cognitive decline, and even impair immunity, all of which are things that seniors cannot afford to sacrifice. To make matters worse, sulfites, preservative chemicals intended to preserve color and prolong shelf life, are commonly added to commercially made dried fruits. Due to age-related changes in respiratory function and the higher prevalence of asthma and COPD in older populations, seniors are more susceptible to severe asthmatic reactions from these sulfites. Sulfite sensitivity affects about 1 in 100 people. However, it rises sharply among elderly people with respiratory disorders. Dried fruits are especially unsuitable for seniors managing inflammatory disorders like arthritis, which affects almost 50% of those over 65, due to the inflammatory potential of their high sugars and chemical preservatives. Second place, bananas that aren't ripe. Unripe or green bananas pose a number of serious health risks, making them one of the worst fruit options for elderly citizens. Even if ripe bananas with brown spots might be a wholesome choice for many. The main problem with unripe bananas is that they contain a lot of resistant starch. This kind of starch is difficult for the small intestine to digest, in contrast to the readily absorbed sugars present in ripe bananas. Seniors who are already dealing with age-related digestive changes like slower gut motility and decreased synthesis of digestive enzymes may experience severe gastrointestinal distress from this resistant starch, including gas, bloating, and abdominal pain. Irritable bowel syndrome and inflammatory bowel disorders, which are more prevalent as people age, make the issue worse for seniors. Beyond only being uncomfortable, unripe bananas are tough to digest. In fact, it may hinder the absorption of nutrients from other foods eaten at the same meal. Seniors, who may already be experiencing nutrient deficits as a result of drug interactions, decreased appetite, or age-related reductions in nutrient absorption efficiency, may find this to be especially problematic. In addition, the astringent substances in unripe bananas, which give them their distinctive gritty mouthfeel, might irritate the lining of the digestive tract in sensitive people, causing inflammation in the gut. According to nutritional analysis, immature bananas have many fewer antioxidants than their ripe counterparts, since the ripening process causes these healthy substances to rise sharply. Because of their lower antioxidant content, unripe bananas are an especially bad option for seniors looking to benefit from the anti-inflammatory properties of fruit eating. First up, grapefruit. One fruit that may surprise many is at the top of our list of fruits elders should avoid: grapefruit. For elderly people using common drugs, grapefruit has potentially fatal hazards, despite its reputation as a health food and weight management tool. Compounds such as furanocoumarins pose a risk because they can prevent your intestines from producing the CYP384 enzyme. Approximately 85 different medicines are metabolized by this enzyme. Drug levels in the blood can rise dangerously high when this enzyme is blocked. It's similar to taking the right amount of medication, but receiving a significantly larger dose than was recommended. This can significantly raise the chance of adverse effects, some of which, depending on the drug, may be severe or even fatal. A wide range of medications are impacted here, including some that are frequently prescribed to elderly patients, such as statins that lower cholesterol, atorvastatin, lovastatin, and simvastatin; blood pressure medications, such as nifedipine; anti-anxiety medications, such as buspirone; anti-arrhythmia medications, such as amiodarone; and even some immunosuppressants and antihistamines. For instance, eating grapefruit while taking a statin like Lipitor can cause the blood concentration of the medication to rise by more than 400%, significantly increasing the risk of severe side effects such as kidney failure and muscle breakdown. The fact that these interactions don't require a lot of grapefruit consumption is even more concerning. Simply separating your medication and grapefruit intake won't fix the issue, because even half a fruit or a little glass of juice can cause harmful interactions, and the effects can last for up to 72 hours after ingestion. Grapefruit tops our list of fruits to avoid or approach with great caution because of the high potential for interaction and the numerous popular medications that are essential for controlling senior health issues. It's crucial to expressly ask your doctor or pharmacist if eating grapefruit or grapefruit juice is safe for you if you take any prescription medications. Don't think it's acceptable. It's just too risky to overlook the possibility of exacerbating the effects or adverse effects of your medicine. This seemingly harmless fruit has a potentially harmful interaction potential that is disguised. Here is a detailed list of the fruits that seniors should eat and those that they should put on the shelf. The healthy ones, including pomegranates, avocados, apples, and berries, can actually make you feel stronger, think more clearly, and age more slowly. On the other hand, unhealthy foods like grapefruit, dried fruits, unripe bananas, and even seemingly innocuous grapes can rob your energy, raise your blood sugar, and cause inflammation, all of which can be harmful to your health. The subtlety of it all is what's frightening. Most individuals don't realize until it's too late that a ripe banana or a handful of grapes could be causing a series of problems inside their bodies. Therefore, make sensible choices, eat with awareness, and whenever possible, match your fruit with protein or a healthy fat. We'd like to hear from you now. Have you been consuming any of these unhealthy fruits without being aware of the dangers? What caught you off guard the most? Have you ever eaten a particular fruit and experienced an unexpected reaction? Please leave your thoughts and experiences in the comment section below. We enjoy listening to them. Thank you for viewing.